Welcome to our module, How Evaluation Purpose, User, and Use Frame Evaluation Choices. This is part of a multi-module series that you may have participated in some other ones. In the one we're going to talk about today, we're going to define what purpose is, show why it matters, and we're going to focus on 3 steps in your evaluation: the stakeholder step, the evaluation focus step, and our final step, ensuring use and sharing lessons learned. At each point, we're going to show you how the definition of purpose, user, use at the start helps frame and guide choices you make at every one of those steps. The reality is that purpose, user, use inform all 6 steps of the evaluation framework. We're just calling out these 3 because we think they present the most potent examples. We've all heard those dreaded words, "we're going to be evaluated," and a lot of times we dread them because of the connotation those words have, and those connotations are often incorrect. Our mind jumps to the conclusion that evaluation is going to be punitive, and especially that evaluation is going to hold us accountable for very, very distal outcomes. And that's true some of the times. Evaluation is indeed sometimes punitive, and there are lots of cases where we're being held accountable for something very, very downstream like morbidity and mortality and incidence and prevalence. But just as often, evaluations are about something else, and purpose, user, and use are the questions we answer to determine what's the appropriate focus for the evaluation. The goal of this is to make the evaluation useful. Evaluations not only are for accountability, they're also for purposes of improving our programs. And for that purpose, they need to be useful. And to be useful, it means that they meet the needs of the key stakeholders. They're informing the decisions and judgments the stakeholders are needing to make. And consequently, the information that's going to be collected is the information crucial for those decisions. So let's think about a real-life example. In real life, we're going to construct a house. Do I need to know the purpose of the house to figure out what the house should look like? I think we'd all agree. Every house has a bedroom, may have bathrooms, may have kitchens. A house is always going to have hammers and nails. But beyond that, I want to know, is it a summer house or is it a full-time residence? Is it a large house I need or a small house I need? Are there legal constraints on how large it can be or how small it has to be? Is the purpose of the house conspicuous consumption to my neighbors, or is it really just a place to live? Is it a house that's going to house an elderly or disabled person? Right? I think we'd all agree that knowing those things about the house immediately takes this general concept, a house, and makes it much, much more specific. Well, the same thing goes for our evaluations. The equivalent of our rooms are that every evaluation is going to have stakeholders. It's going to have a program. It's going to have a focus. It's going to have to collect data. But just as our house varies with the purpose, user, and use of the residents, so our evaluation choices are going to vary and vary widely depending upon the purpose, user, and use of the evaluation. Here's our module overview. We're going to present a relatively straightforward case study. That case study is going to contain 3 different scenarios, and in each one of those scenarios we're going to walk you through the 3 main steps. Now remember, these are 3 steps of the 6 steps in the framework. But in each one we're going to show you how that purpose, user, and use choice varies with the scenario, and conversely and concurrently changes the evaluation choices that are going to make the most sense. So here's our case study. I'm going to read it slowly to you, and then I'm going to walk through the scenarios. And then we'll be repeating this case study at the other steps very quickly. The Asthma-Friendly Pharmacy, or the AFP program, is an effort to improve the health of asthma patients by encouraging them to use their asthma control medications properly, thereby reducing their reliance on rescue inhalers. The AFP program encourages pharmacies to integrate very focused patient education into the normal pharmacy workflow. This requires moving from a focus on products to a focus on patients. The intervention itself involves a specialized AFP program trainer. It can be a pharmacist, a physician, a certified asthma educator. That person trains both pharmacists and pharmacy techs so that they can deliver patient education. The second part of the intervention is the patient education materials themselves, simple messages of the month that are put in with the prescription. The third part is promotional activities that identify the pharmacy as being asthma friendly, and then finally marketing materials to recruit new customers. The desired outcome of this intervention is that patients achieve good control of their asthma through the appropriate use of their asthma medications. So the first step we're going to deal with is engaging the stakeholders. And here we're going to show how understanding purpose, user, use helps you narrow down what could be an infinite number of stakeholders to a manageable number. Stakeholders is a very broad word, and it can encompass dozens and dozens of folks depending upon how broadly we define it. However, the key stakeholders, as we've cited here, are generally the ones we need to facilitate access to data or data collection, people we may need to increase the credibility of our effort, whether that effort is the evaluation or the intervention we're evaluating, the people who are responsible for implementing the interventions and who will use these findings to improve the intervention, people who advocate for changes, and of course the people who provide funding or authorization. So all those folks are stakeholders. Why do we care what they think? Well, I think we're going to care because we want to know from the start whether they have the same idea about purpose, user, and use of this program as we do. Because once we come to agreement on what the stakeholder needs and who the key stakeholders are, it's going to influence who we really need to engage. Scenario A of the two scenarios is replication and expansion of a pilot program. So let me read this scenario to you, and then we'll turn to what the implied purpose, user, and use is within the scenario, and then how that purpose, user, and use in our first step, stakeholder engagement, is going to help us define which of the many stakeholders are going to be most important. So scenario A, one store of a large retail pharmacy chain successfully implemented the AFP program. More patients are patronizing this pharmacy, and asthma patients at this pharmacy have reduced their reliance on rescue medications, which, remember, that was one of our intended outcomes. The program was spearheaded by a pharmacist champion and funded by a large retail pharmacy chain. Now the pharmacist champion would like to convince the pharmacy chain's regional manager to expand this pilot project into all of the company's pharmacies in the area. The pharmacist champion has asked you to evaluate the pilot project and provide the regional manager with the information that he or she would need to decide whether and how to introduce additional AFP programs in that region. So how would we begin to design this evaluation? Well, the title of this module is Purpose, User, Use, and how it frames choices. So of course the first step is going to be to look at the purpose, user, and use embedded in this evaluation scenario. What's the purpose of this evaluation? Why are we doing it? To gather information to support the replication and expansion of an asthma-friendly pharmacy pilot program to additional sites in the region. Who's going to use this information? Who's going to make the decision based on the information? The pharmacy champion is the one that's asking us to collect these data, but the ultimate decision maker is going to be the pharmacy chain and the pharmacy chain regional manager and the pharmacist from the potentially adopting sites. Right? How is the data going to be used? The data is going to be used to learn what resources would be required to expand the AFP program so a decision can be made about whether, how, and when the program can be expanded. Now notice, we're not being asked to collect data on whether the program works. We already know that from previous data collection. Rather, what we've got is a really efficacious program, and the pharmacist champion is trying to convince the pharmacy to expand it regionally. So the first question is going to be, of the millions of stakeholders potentially involved in this, and I've listed about a dozen over here on this slide, who are the key stakeholders? Now nothing precludes you from engaging every one of these stakeholders, but remember, our verb is engage, not just identify. And so the act of including a stakeholder means engaging them, thinking about what's important to them, asking them what they want from the intervention, etc. And so we always have a vested interest in trying to focus in on the stakeholders that matter most. Right? Who matters most for this scenario? Again, when you think specifically about this scenario, I think of that long laundry list of stakeholders, the ones that matter the most, i.e. the ones I want to engage to make sure they're on board and on board with each other, are the pharmacist champion, the pharmacy chain regional manager, pharmacists from the potentially adopting sites, and the pharmacy chain CFO. That is the person that holds the purse strings at the pharmacy chain headquarters. These are going to be the people who advocate for the program or who have the authority to decide whether or not to expand the pilot program, which is the purpose and use of the data from this evaluation. Scenario B, by contrast, is a program improvement scenario. So let's look at this different scenario. It's the exact same case study, our AFP program, but with a different context. Same thing. We're going to now look and see whether purpose, user, use, and the key stakeholders are going to be different in this case. Right? So in this scenario, a state asthma program manager persuaded a large pharmacy chain to replicate and expand a successful AFP pilot program. Okay, so our pharmacy champion from the first scenario was successful. It's now expanding regional wide or perhaps company wide. However, the patients at one of the new AFP locations are declining to participate, even though the program is at no cost to the patient and a private consultation area is available. The state asthma program manager has asked you to do an evaluation to help them understand why is the AFP program foundering at this one location. Again, the implication being that it's being very successful at the pilot stage and also at some other locations. Right? Now this time I'm going to ask you how you would begin designing this evaluation. Now, I think you already understand. What you're going to need to do is look at that scenario and say, in this case, what's the purpose, user, and use for this evaluation in this scenario? So give yourself a moment or two to do that. Here's what I came up with. So take a look at my answers and see if they're close to yours or if you can live with them. What's the purpose of this evaluation? Okay, in this scenario, the purpose is to understand why patients at this location are not taking advantage of the free asthma education opportunities to get better control of their asthma. In this scenario, who's going to use the information? Who's going to make the decision? The state asthma program manager, the lead pharmacist at the location, the AFP program trainer, and community representatives. Right? So there's something going on in a particular site such that a program that's been successful in some sites is not successful here. So you can see that the users are mostly going to be folks related to that site. What will the evaluation data be used for? To identify and eliminate the barriers to program participation and to improve the marketing of the AFP program in this neighborhood. We see our same list of stakeholders in this case, and here the question is going to be, for this scenario, who are the key stakeholders? Again, nothing precludes us from engaging every single one of those stakeholders, but it's going to take a lot of time. So we always want to ask ourselves, in this evaluation scenario, who's going to be key? So take a minute and take a look, and who would your decisions be? Here's who I chose, and see if you agree with me. The community representatives, the lead pharmacist, the state asthma program manager, since that's the person expressing the concern, and the AFP program trainer, because there are probably going to be some barriers we're going to see locally that really need to be addressed differently by the program trainer vis-a-vis the other sites that they're working with. Right? The state asthma program manager is the client. The AFP program trainer and the community reps are going to be folks who can provide the needed information that might unlock the key to how to make this a more effective program at this particular site. So let's compare and contrast, and that should drive home the point that purpose matters. In both cases, we have the same case study, but we have two evaluation scenarios. Scenario A, replication and expansion. Scenario B, program improvement at one foundering site. The purpose, as you can see, is different in each case. Purpose in scenario A is to gather information to support replication and expansion. The purpose in scenario B is replication and expansion have already occurred, but one location is not working. We need to figure out why. The stakeholders conversely differ for scenario A and scenario B because the purpose is different. In scenario A, the pharmacy champion, the funder, the chain regional manager, and the pharmacists from the sites we're trying to get to adopt are all the stakeholders we're going to need to engage to make sure this evaluation provides data and answers questions that are important to them. We want the same thing to happen in scenario B, but in that case we have a cast of characters that's slightly different. The state asthma program manager, the lead pharmacist, the AFP program trainer, and a host of folk from the community where we have this foundering site. Now, we've only brushed on at the high level on these things. Here's a couple of links that will help you get into engaging stakeholders in more detail. Now let's go through the same drill, but we're going to progress from engaging stakeholders down to step 3, focus the evaluation design. Now remember, we're calling out specifically 3 of the 6 evaluation framework steps, but this idea of purpose, user, use is going to inform any step. We just think these 3 are really good illustrations of how important purpose, user, and use can be in helping you narrow down what could be infinite options to the ones that make the most sense for a single evaluation at a single point in time. Right? So at this point we're going to turn to focusing the evaluation design. Quick review of evaluation focus. We want to focus the design because theoretically there are an infinite number of plausible evaluation questions we can ask, and all of them at face value are usually valid. However, we don't usually have the time, energy, motivation to evaluate every single plausible question. So what we want to do at the evaluation focus step is narrow in on the priorities for the evaluation focus, and that of course is going to inform the kinds of evaluation questions I most want to ask. Basically, evaluation focuses fall into 5 types or flavors, and a single evaluation may include only one of these types. It may include all these types. Usually it just includes some of them, although over the life of a program the types of evaluation focus are going to progress. So the first focus, and one we're all familiar with, is process evaluation, and here the questions being asked are going to focus on: did I get the inputs I needed? Could I mount the activities and outputs as I intended? By contrast, we usually experience evaluation as outcome evaluation, and there the questions are going to be: did the program work? Was the program effective? Did it have the intended impact? Efficiency evaluation is an increasing focus for evaluation, and there you're really looking at the juice squeeze question. If I give this much as resources, whether it's funding, staffing, or time, how much output? How much did I produce? So it's an input-output question. Causal attribution, by contrast, is looking at the connections between my activities and my outcomes. Can I show that the outcomes I achieved occurred because of the activities and outcomes that I produced, as opposed to a host of other factors? And then finally, cost evaluation, or sometimes prevention effectiveness evaluation or cost effectiveness evaluation. There the questions are often of a cost benefit or a cost effectiveness nature. Given the investment we made in this, what was the return on the investment? Did we get enough outcome to justify the investment that we made? Now here's the important point. While all 5 of these basic types are not usually in play in a single evaluation, every one of these types of evaluation is important. So the purpose of introducing purpose user use at this point is to help me focus in or home in on which of these sets of questions are most important, so I don't default to asking all of these questions all of the time and driving myself crazy and busting my budget. So again, here's our AFP case study. Just to remind you really quickly, the intervention involves a specialized AFP program trainer who trains the pharmacists and the pharmacy techs so they can deliver patient education materials which are inserted in with the prescription, promotional activities that pitch the pharmacy as asthma friendly, and then marketing materials in the marketing area to recruit new customers. We want to do this intervention because we're trying to get patients to achieve good control of their asthma by using their asthma medications appropriately, and we were exploring 2 scenarios, as we will in this case as well. Scenario A, we want to expand this pilot project company-wide or at least region-wide. Scenario B, it's been expanded, but it's doing well at some locations, but it's not doing well at one location in particular, and we want to figure out how to salvage it. So the exact same scenario, again, in this scenario, we're trying to we're trying to take a pilot program and replicate it and expand it across the company. The purpose user use, again, as a reminder, we don't need a new purpose user use, rather we're going to deploy them to help us set our focus. Purpose, gather information to support replication and expansion. Who's going to use? The pharmacy champion. The pharmacy chain, who's the funder, the pharmacy chain regional manager, and of course ultimately the frontline pharmacists we're trying to get to adopt this program. How are they going to use the data to figure out what resources are going to be required to expand it so they can make decisions about whether to do that or not, how to do it, and when to do it. So how do we turn this into helping us decide where to focus the evaluation? Well, in step 2, which we're not going to cover in this session, you may have done a logic model. If not, you did something in step 2 of the evaluation framework to help understand your program. I've chosen to display it in typical logic model fashion. So the typical evaluation program, the typical intervention that we would evaluate has a set of resources or inputs. It uses those to mount activities which produce deliverables or outputs, and that gets us a whole sequence of outcomes. So the question here at step 3 is, what part of this logic model or what part of this program, including every part of it, should I be examining? Should I be focusing my questions on the inputs, on the activities, on the outputs, on the outcomes, or conversely, should I be looking at the entire background, context, and assumptions that underlie this program? In this case, I think this is mostly about inputs, right? We already know that the program is effective. What we're trying to do is to persuade people that it ought to be replicated company-wide. So the decision makers need to know the inputs. What are the resources they're going to need to provide? And that could be money, could be time, could be physical facilities, could be opportunity costs of the pharmacist to do this as opposed to other things, to expand the program to other sites. So, just as with stakeholders, there's an endless array of questions. Here we've called out 10 or so questions that might make sense. And when we think about this scenario, the question is, which of those questions is going to be most useful and most relevant to get us the information we need for this scenario? Right? So I made a judgment call here, and you may or may not agree, that of all those questions, and again, we can examine every one of those questions, but that's going to be time consuming and bust the budget. I felt the most useful of those questions was going to be, what resources are required? Are there essential elements at the pilot site that will be difficult to replicate at other sites, i.e. what's the generalizability of the success at this pilot site? And what training do pharmacists need to participate effectively in the AFP program? We know that from the pilot site, but again, we want to be conscious of, is that going to be a little different requirement when we start moving this out region-wide or company-wide? The questions on the right-hand side are great questions. I just don't think that for this scenario, if time and energy are limited, they get at the heart of what the user of this data really wants to know to conduct this evaluation. Right. So this scenario provides a really good example of why it's important to focus the evaluation design before you jump into evaluation questions. So it's easy to say, gosh, what are the key questions being asked here? But what's going to be a much more comprehensive and thorough way, systematic way to make sure you're landing in the right place is to ask yourself first, what part of the program needs to be in play? Are the questions primarily about activities, primarily about inputs, primarily about outcomes, primarily about context? And once we have that sort of evaluation focus in mind within the program, then it's easier to translate that into questions. So given this evaluation purpose and these key stakeholders, we must focus the evaluation in a certain area. And in this case, it was on the inputs. And once we knew we had to focus on the inputs, it became very clear when we looked at the list of all the possible questions, which three were going to most relate to this evaluation focus we decided upon. Okay, now let's contrast that with scenario B, and we're going to go through the same process we did with scenario A. But again, here we'll see that the difference in purpose user use in scenario B is going to lead us to a different evaluation focus. Right. So remember, in scenario B, we're trying to understand why a program that was successful as a pilot and is successful in many, many other locations around the region and the company, why it's failing at one location. So how would you begin? Well, again, you're going to look at your purpose user use. So let me refresh your memory on what those are. In this case, the purpose to understand why patients at this location are not taking advantage, whereas patients at other locations are. Who is going to use it? The state asthma program manager is the one that's initially puzzled by this. The lead pharmacist at the location, of course, and the program trainer, of course, is going to ask, gosh, how come my program training is working every place else but here? And community representatives who probably can provide some insights on what's specific or peculiar about that neighborhood or that community. And how's it going to be used? To help identify what the barriers are, what's special about this situation, and how can we eliminate the barriers so that this will be a successful location just as the other ones are. Right? So here's an implicit logic model for this. It's the same logic model implicitly that we had for scenario A, but the question here is a little bit different. When you look at scenario B, where are the evaluation questions primarily going to focus? Are we really asking questions about inputs, about activities, outputs, outcomes, or about context? So give yourself a minute to think about that. I'll show you the answer I came up with. In this case, you could certainly make the case that this is somewhat about outcomes because the presenting problem is that the outcomes here are really at variance with outcomes in the rest of the program, okay? But I don't think this is an outcome evaluation. Rather, what happened is the outcome evaluation we did caused us to realize that this one location is an outlier. So the question at hand here is, how come this place is an outlier? What's going on? And I think that answer lies in context and assumptions. If we implemented this 20 places and doggone it, it's working in 19 of them, there's something peculiar to the situation in Site 20 that we probably need to uncover. And so I see that as an evaluation focusing primarily on context and assumptions. Now, why is that useful to us? Well, once again, here's our 12 questions, our dozens of questions potentially, and here's some that we called out in particular. I can always answer all of these questions and collect data, but I don't have the time and energy or the budget to do so. So knowing now that I primarily want to deal with contextual questions, I'm going to ask myself, which of these questions looks like it's going to be most helpful? So take a minute to take a look at it, and then I'll show you what I came up with. Again, I came up with 3 questions that I thought were going to be most important here. Now again, all these questions are valid and probably yield some benefit, but the 3 I felt were going to be most important were, could we get at what barriers discourage patient participation? Or try to uncover, is there a physical barrier? Is there a time or a language barrier talking about this? What are community members' perceptions about the ability of pharmacists to provide accurate medical information? Again, in this case, we're trying to jump backwards from, if something's working 19 out of 20 times, why isn't it working in this 20th location? Well, the mind immediately leaps to something's going on with barriers, something's going on with perceptions of pharmacists, or something's going on with misperceptions about the program. And so our third question is, what benefits do patients perceive from their participation in the program? We know what benefits we want them to perceive. It certainly seems like they're perceiving those benefits in the other locations, but we want to see if something is being miscommunicated here. Now, why is this helpful? Because it helps us narrow down that evaluation focus and our time and effort to the 3 questions that are going to most help the users of these evaluation findings to answer their evaluation questions. So again, let's compare and contrast. Same case study, same purpose, user and use as we used in step 1, same 2 scenarios. But in this case, we can see that the purpose for scenario A and scenario B led us in both cases to a completely different evaluation focus, and that focus in turn led us to a different set of priority evaluation questions. So scenario A, when we wanted to gather information to support replication, the key thing was program inputs. We already knew the program worked. We wanted to get some sense of whether it would be sticker shock or not to expand it. What are the evaluation questions we thought were going to be most useful from the list we presented? What are the resources that are going to be required? But beyond that, are there critical elements that are going to be hard to replicate? Again, that's sort of a resource question. What training will pharmacists at other sites need to be able to participate effectively? Again, that's sort of a resource question. If every site's going to be a little bit different, then at what point do you start pushing training on pharmacists and it starts interfering with the other things they're trying to do? Scenario B, by contrast, we've got something working 19 out of 20 places. We're trying to figure out why it's not working at site number 20. Here we decided that, again, it's not about outcomes. It's the fact that Site 20's outcomes look so different that's causing us to do this evaluation. So what we're looking at is what's going on behind the scenes in the context and the assumptions that might be leading to that outlier performance. So here our useful questions are going to be the logical things that we can think of that might be causing the problem and trying to figure out if they're the source of the issue. Are there barriers? And if so, what are they? Physical barriers, time barriers, language barriers that keep patients from being able to participate actively? Are there perceptual barriers from the community members about the ability of the pharmacist to provide accurate medical information? This could be a community where no one trusts anyone but their doctor. They don't understand that their pharmacist knows as much about medications as anybody. And then finally, it could be that everything's going swell, but the patients just don't see the benefit of doing this. For whatever reason, we have not made that persuasive case that you can control your asthma symptoms and you control it yourself by accurate use of your medication. Well, we're going to take very different action if it turns out that's what's causing these outlier outcomes. Again, we've only covered this superficially. If you want to dive in more and learn more about how to think about evaluation focus, then here's some resources for you to use. And finally, we're going to turn to the third illustrative step of the 6, and that is our final step, step 6, ensuring use and sharing lessons learned. Now, as any of you know from listening to the other modules, this is really the culmination and actually the reason that the CDC evaluation framework looks the way it looks. That evaluation is never for the purposes of gathering information for information's sake. It's always got an intended use in mind. So we're always trying to maximize the chances that our evaluation findings will be used and that the lessons we've learned from this will be shared and shared in a way that's going to encourage use. So the question at this point becomes, does purpose, user, and use of the evaluation help us home in on the best way to share findings and the best way to ensure that those findings turn into program improvement? Here are the common factors that we mostly cite in the literature when we look at why is it that some evaluations get used and other evaluations just sit on the shelf. And they fall into 4 categories, and I'm sure there's nothing here that surprises anybody that does evaluation. Buy-in. We have to understand what the key stakeholders consider to be the purpose and provide them with the findings that meet their needs. Credible evidence. We've got to be comfortable that the evidence we're going to provide meets the criteria for accuracy and credibility that the users set, and of course that's going to be very different situation to situation. Political factors. Data are always in a political context when we're doing evaluation, and so there's going to be some data that just cannot be heard. Right? And timing. There's always going to be a teachable moment, and sometimes that teachable moment is the end of the project, sometimes it's when some crisis is happening. And so all of those things, the presence or absence of them, or the 4 of them in combination, help predict whether or not the findings from a particular evaluation are going to turn into use of any kind or not. Okay? By contrast, in terms of sharing lessons learned, we're really talking about the many, many ways in which we issue our evaluation findings. So we call this an evaluation report, but that's really, really a misnomer because report automatically conveys a hard copy document, often a very thick document. All right? And it needn't be at all. What we mean by evaluation report is, all right, we're at the point where we have the findings, we've drawn our conclusions, we make our recommendations. How is it that we're going to package this so that it sings to the intended users, understanding that that intended user is going to be very different scenario to scenario. No matter how we package this, the evaluation report, and again report is in quotes, however we package these findings, we're going to have to touch on the purpose of the evaluation, the focus and its limitations, the plan and procedures we used. We're going to want to present those results clearly and succinctly. We're going to want to make specific and feasible recommendations. But all of this is going to be done in a format that's going to match the situation. And this is particularly where purpose, user, and use is going to help us. So here's a whole array of ways in which we can package evaluation findings, from formal written reports, which is probably the immediate connotation that comes up in your mind when I say evaluation report, all the way down to press releases, to something in the middle we call action planning sessions, where perhaps very little hard copy is going to be shared, but rather we're having a conversation about the findings. Situation by situation, some or all of these are going to be appropriate or inappropriate as the best way to motivate the user to put the findings to use. Right? So let's go to our scenarios and see how different evaluation purposes, users, and uses helps guide the way in which we're going to package our findings. Right? Here's our case study again. I hope I don't need to go over it again. Here's our scenario A. Remember, for those who have forgotten, it's about replicating and expanding a pilot project that we think has been very successful in the pilot. Purpose, user, use, gather information to support replication and expansion. The users, the champion, the company that's trying to expand or decide if it wants to expand, the regional manager, and of course the pharmacist at these individual sites we're trying to expand to. What's the data going to be used for? To figure out what resources we need and make a judgment call on whether these resources are doable or too extensive to warrant the expansion. So, just as we had a list of questions in step 3, just as we had a list of stakeholders in step 1, in step 6 what we have is a list of potential ways, and we haven't even begun to exhaust all the ways, we've just called out a decent number of them. Looking at these ways of doing it, what's the best way to communicate these findings, understanding who the purpose, user, and user is in this case. In this case I decided it was an executive summary, and you could persuade me that it needs to be more than that or less than that. Right? Why? The decision maker group in this case is small and it's well acquainted with the context. So really all we need to do is a brief and well-focused communication format targeted really to the business people, right? Now, if we went into this a little bit more deeply and talked about the credibility of the information, etc., there are all kinds of design stuff we'd want to do. For example, this has really got to have a lot about the numbers. There has to be a reasonable certainty about the numbers in the business model. But the reality is none of this takes a lot of paper to explain. It just has to be very focused because the decision-making group is small, and we know what the decision-making group is looking at. Is the juice worth the squeeze? What's it going to cost me? Is it going to give me sticker shock? Or like the pilot, does it look like something worth investing in? Scenario B, by contrast, we're trying to decide why it is that things are not going so well in site number 20, even though they're going great in the other 19 sites. Purpose user use, understand why patients here are not taking advantage, even though it's free. We have a whole cast of characters who are curious about this and really would love to solve the problems or can help provide the information to solve the problem. And the data are going to be used to figure out what those barriers are, and to the degree we can eliminate them, figure out the way forward to eliminate them. All right. Now this time, what would you choose? So looking at that purpose, user, and use, understanding you've got this kind of active group that may not trust or know each other very well, interacting, what do you think the best format for communicating these findings and turning them into use is going to be? And again, don't default to the formal written report, even though that may be a part of it, but think about how do I get use of these findings or maximize use of these findings. So give yourself a minute to think through this. Now again, you could persuade me otherwise, but I think in this case an action planning session is going to make the most sense. The AFP trainer and the pharmacy staff need to understand why patients are reluctant to participate in the program and then discuss among themselves how to address the patient's concerns. Now again, we're jumping ahead and guessing at what the evaluation is going to find. But remember, our three questions are presuming that the fault lies either with consumer perceptions, which we correct with our marketing campaign, consumer perceptions of the competency of the pharmacist, which again is a marketing communication task, or there's some physical, time, linguistic, or other barrier that keeps the person that we're trying to get to from participating. So in all cases, I think we want a really interactive setting where people can mull over, discuss, come to agreement, or question these findings so that they can walk out with some fairly informed ideas of what next, since it's the people in the room that are going to be the ones that most can come up with the solution to these problems and how to get rid of these barriers. Comparing and contrasting again, we had two scenarios, both completely valid. Two different purposes led us to two different best ways to package the findings. When we were trying to make the case for expansion, it was going to be a heavily quantitative, financial, business model type of report, but it was going to be short. Executive summary was going to be just fine. Here's what it's going to cost us. Let's make the decision it's worth it or it's not. On the other hand, scenario B, we could have a very, very thick report, but the question is less what the report says and how do we feel about the findings and what are we going to do about them. So it's really about action, and it's really about a cast of characters from the community and from the pharmacy getting together, sitting down, and figuring out what these findings mean and how can we address them. And so action planning session, which was the most interactive of the formats we listed there, makes the most sense. Okay. As with steps 1 and 3, we've only had a chance to deal with this superficially. Here's some really good links if you want to dive in and learn more about step 6, how we ensure use and share lessons learned. Now we're going to do one more scenario, and we're going to walk you through it soup to nuts. And again, it's just to reaffirm and drive home the points we've already made. Okay. Scenario C is justifying program expenditures. For the last 5 years, a major pharmacy chain has supported an asthma-friendly pharmacy program at all of their retail locations in one city. They hired a dedicated AFP program trainer to train pharmacists and pharmacy techs, to create and update program materials, and to promote the program to the community. The company's regional manager has asked you to evaluate the cost of the AFP program and its benefits to the company to justify their continued investment. They also want you to identify healthcare partners that might share some of the future costs, because that's going to factor into their final decision about whether to continue this or not. So how do we begin to design this evaluation? I'm sure what jumps into your head is I got to look at the purpose user use. And now, scenario C in some ways looks a lot like scenario A and B, but there are additional elements here that look very different. And that's what you want to focus on and concentrate on in looking at the purpose user and use of scenario C itself as an evaluation scenario. So give yourself a minute or two to think about that. What's the purpose? Why are you doing it? Who's going to use the information and who are the decision makers? What are they going to use the evaluation data for? What decisions are they trying to make? So give yourself a minute or two to think about that. Here's what I came up with. If the purpose of this evaluation in this case, unlike scenario A and scenario B, is to assess the costs and the benefits to the company of continuing the AFP program and to identify possible funding partners. I think because the company understands it's going to incur a lot of costs if it's funding this solely by itself. Who's going to use this information? The pharmacy chain CFO, that's the person who holds the purse strings. The pharmacy chain regional manager, because it's been implemented at pharmacies in a single region. The pharmacy chain marketing department. And then conversely, a whole bunch of funding partners who are hoping we can show persuasive enough evidence that they'll jump on this and think it's worth helping to fund themselves. How will the evaluation data be used? To decide whether to continue funding the AFP program and at what level, but related to that is so that funding partners can decide whether or not they want to jump on board, which of course in turn is going to affect the level of investment that the company needs to make in the AFP program. Okay. Our next question, I haven't changed any of the stakeholders. We're just going to look at, now that we've changed the scenario, do the key stakeholders matter? So, who do you consider the key stakeholders to be? In this case, the hint is, who are the people who can facilitate communication among all the stakeholders, provide the information we need, and have the authority to implement any of the changes in this case? So give yourself a minute to look at this, make your choice. Again, we could have chosen all those stakeholders. At this point, we've probably already talked to them if we were part of scenario A and B, but the ones that matter specifically for this scenario are the pharmacist champion, health insurance industry representatives. Those are some of the potential funding partners we're trying to persuade. The pharmacy chain regional manager, it's his or her bottom line that's getting smacked by this expenditure on AFP if we can't prove the benefit. The pharmacy chain CFO, for the exact same reason, the company and its stockholders are going to start asking, where's all this money going and what's the return on investment? And the pharmacy chain marketing manager, who may say, gosh, I don't care what it's costing us, we're benefiting widely and wildly in terms of our brand. Now, compare and contrast. Again, you remember scenario A, scenario B. In both those cases, the purposes led us to a very different cast of characters as stakeholders. Now look at scenario C. You'll see that we have a slightly different cast of characters incented by that purpose, user, and use as well. All right. So since the purpose was to assess the costs and benefits to the company and to identify and lure in possible funding partners, then the cast of characters we care about most are pharmacy chain CFO, pharmacy chain regional manager. Both of those are the folks who have to defend the ROI. The pharmacy chain marketing manager, the pharmacist champion, who of course is a big champion of this program, doesn't want to see it die. And then most importantly here, this isn't shown up in any of the other scenarios, people from funding partners, and particularly health insurance, who might look at these data and say, golly, I'm saving a ton of money if people will manage their asthma through this program. Now, we got to turn to the issue of focusing the evaluation. So we've identified who the key stakeholders are, and what some of the key questions we may need to ask is the question we're going to ask next. Here's our logic model. It's the same logic model implicitly that we had for scenario A and B, but in scenario C we're asking ourselves, when we look at the questions being asked, the purpose, user, and use, what part of this logic model are most of the questions going to be about? Right? What part of the logic model do we need to focus the evaluation on? So again, we have the 5 choices: the backdrop, context, and assumptions, the inputs, the activities, the outputs, or the outcomes. And of course, it can always be more than one. Give yourself a second or two to think about this. When I look at this, I think for scenario C, unlike some of the other scenarios, the most important questions are going to be both input questions and outcome questions. Right? Why? The purpose of the evaluation in this case is to justify additional investment, so the focus is on cost versus benefit. So the costs are going to be the inputs, and the benefits in this case are going to be the intermediate and the long-term outcomes, right? And particularly if we're trying to lure in a funding partner like the health insurance industry, I can almost guarantee that what we're going to need to demonstrate is that the investment of this program made a difference fairly far downstream in some of the health outcomes they're looking for or looking to stabilize in people with asthma. So if we can prove that people use their inhaler meds, it's great. If we can prove that people took their medication on time, great. But the thing that they're really looking for is that this paid off in terms of how many hospital visits or how many disruptive and expensive interventions had to happen because they weren't managing their own care well. So here's the evaluation questions this might translate into. Take a look at these. Again, they're the same questions you've seen before, but I think what we'll see is that in this scenario, we're going to focus on some that we might not have focused on as much in other cases. Conversely, in the other scenarios, other questions may have been important that for us are not so useful when the purpose, user, and use is the one we just named. So take a minute to take a look at it, and then I'll show you what I came up with. In this case, I think the questions of that list that are going to be most useful for this purpose, user, and use is the first one. What resources are going to be required to continue the AFP program? What community partners might share some of the cost? A lot of that's going to depend upon what our data show the level of achievement of the outcomes is. And what sales and marketing opportunities might be derived from continuing the program. Why is that last question going to be important? Let's say we can't lure in a whole bunch of health insurance industry representatives. Well, particularly the marketing manager may make the case that, well, even if this is fairly costly to us, and even if we can't yet make the case to lure in health insurance industry partners, we're getting major marketing opportunities out of this. The brand of ourselves as an asthma-friendly pharmacy is leading to more customers, etc. So all of those are questions that are going to be worth asking, even though they may not have been as useful questions in scenario A or B. Take a look at the questions for scenario C. The questions for scenario A and B, which were informed by their purpose, we've already dealt with. You can see that one or two of the questions overlap with questions we're asking in scenario A and B, but we're really asking them for a very different purpose here. We're really trying to make the case for justifying expenditures and proving there is benefit of our investment. So the questions are key. What resources will be required? What community partners might share the cost? Let's say we can't learn a lot of partners. Are we yielding enough benefit from a sales and marketing opportunity that we may still want to continue the program? Finally, just with our other scenarios, we're going to close the loop by looking at, once I have my findings, given the scenario's purpose, user, and use, what's the best way to package these findings to ensure that someone's going to use them to change? Right? Here's the normal 6 or 7 ways in which we can package findings. When you think about this use, which one do you think is going to be the most effective? So take a minute to take a look at it. Here I really would side with the formal written report. This is a business decision, and it's complex, and it involves multiple business partners who are not well acquainted with the AFP program, particularly the part of the evaluation that's going to stretch beyond the inner circle of the people within the pharmacy chain and try and lure in people as potential funding partners. So a formal written evaluation report is going to make the most sense because we're going to need some fairly detailed information to make a convincing case. Now, it doesn't mean it's the only thing we're going to do. My guess is a lot of the people reading this formal written report are not going to have a lot of time, and we probably want an executive summary for the senior decision makers. But eventually, someone at some point to make a decision is going to want to see all of the data behind these decisions and all the data supporting our decision that this does have a decent return on investment or that it doesn't. So again, comparing and contrasting scenario C, you can see that just like A and B, scenario C has led us to a very specific preferred format. That format is informed by the purpose, user, and use of scenario C. And in this case, it's the one where we want to default to what's our most common way of thinking about packaging evaluation findings, a formal written report. To wrap up, All the 6 evaluation steps in our framework are important. All 6 of our steps in our evaluation framework are indeed informed by purpose, user, and use. We called out 3 just to illustrate how important purpose, user, and use can be in helping to frame your evaluation choices. Why do we care about that? Well, if you have infinite time, energy, and money, we don't care about it. But the fact is, we never have infinite time, energy, and money. We always have a vested interest in homing in on the evaluation questions that matter most, the data collection approaches that matter most and are going to be most credible, and thinking most about how to package findings for use. Purpose, user, and use help us narrow down what could be sometimes an infinite number of options to the set of decisions that makes the most sense for this evaluation this time. It ensures that the evaluation is going to be useful, feasible, accurate enough for it to turn into program change.